Welcome to another episode of Get Hydrated. I'm your host, Brandon Plafka, and also the founder of Hydra BPM, sponsor of our show. I'd also like to thank our new sponsor, WorkHere, a company innovating the way you find local quality candidates. Here's a word from their Vice President of Client Success, Doug Applegate.
WorkHere is helping employers identify and hire local talent faster. Through our hyper-local candidate delivery platform, WorkHere's combination of know-how, service, and patent-pending technology delivers to employers more and better local talent, reducing employee turnover, helping capture revenue by optimizing staffing needs, reducing the cost per hire, and improving employee satisfaction. WorkHere is helping employers identify local candidates through accurate targeting and mobile ad technology, engaging in community chat, which instantly responds and interacts with job seekers, employers alike. WorkHere's platform manages and delivers in real time active and engaged candidates ready to be interviewed and hired. WorkHere's innovation is in our DNA. Our people invented the first job board, created modern digital video, and helped define the standards used by companies and governments around the world to exchange HR data. We're innovating again with WorkHere's platform by using location and conversational media to engage faster, deliver a better candidate experience, and help you hire better. To learn more, call us today at 317-897-1928, go online to workhere.com, or email us at info@workhere.com.
I apologize for no content being released last week. I was sick, and the downfall of being a solo host for the show is when you're sick and you have no voice, there isn't much of a backup plan, unfortunately. But feeling better now as far as the voice is concerned, still a little stuffy, but we'll keep pushing forward. Also a reminder about the secret word giveaway. Listen for the word. Go to hydrabpm.com. It's HY, D as in dog, R as in Randy, A, B as in boy, P as in Paul, M as in Mary.com. You enter the secret word, enter your contact details, and you'll be entered for some free gift giveaways that we're doing every time we release new content along with a new secret word. And while we're talking about it, today's secret word is capital. So again, go to hydrabpm.com, enter capital, your contact details, and you'll be entered into the drawing to win some free gifts. Our guest today spent the early part of his career on Wall Street before moving on to M&A and leverage buyout. Now he is the principal for a local venture fund focused specifically on the healthcare space. His name is Alex Shortle. Well, Alex, thanks for joining us today. I appreciate you taking some time out to meet with us.
Yeah, it's wonderful to be here.
First thing I wanted to talk about, with you being with Meridian Street Capital, I want to see if you could give us a little insight on kind of what that current portfolio looks like and some of the other companies maybe that you're looking at.
So Meridian Street is an early healthcare IT venture fund investing nationally. So we do seed Series A deals coast to coast. You look at the portfolio, it is definitely skewed to the coast, and that's just a product of the deal flow we see. So some recent companies we've invested in, a company called Safe Ride Health out of LA. They do especially an Uber for medical transit. Company called Hint Health, based in San Francisco, we invested in about 24 months ago now, who also has subsequently gone on to raise another round of funding, is a DPC, direct primary care, kind of practice management platform for managing their member base. Company called Decent Health, which is the newest investment, and this one's still a little bit under wraps, but they're looking at kind of disrupting health insurance, leveraging blockchain and very small, effectively associate health plans. That one's very interesting. I'd say that one's probably the most kind of bleeding edge of the portfolio, but one that we're very, very excited about. And we did that deal alongside Menlo and some other big Silicon Valley venture firms.
Do you feel like, there's so many things in the healthcare space right now with artificial intelligence, machine learning, predictive analytics, blockchain's now kind of the new big terminology that's getting important. Two-part question, I guess. One is, do you feel like blockchain is really looked at the way it is on your side, the same way it is kind of in the market and like what you read online?
Yeah.
And then just in general, in the VC space, right? You can go to entrepreneur.com or inc.com and you can see all these things about what works and what doesn't.
Yeah.
Do you feel like those are pretty good, pretty well in line, I guess I should say?
Yeah, I think so. I think blockchain ultimately is a huge opportunity for electronic medical records, claims, and all that. Security is a big concern, so it's relevant there. And also just personal ownership of your medical record is super important. So there's a number of companies looking at doing that with blockchain technology. Then the claims adjudication, kind of how you're tracking and paying for the health spend, also could definitely be placed on a blockchain. But the challenge there is ultimately you're dealing in a highly regulated environment, big payers that don't like to be disrupted. So that one's going to be, I think, a challenge.
Yeah, absolutely. That actually a great segue to another question I have. So, given regulation, continuous change, heavy requirements in the healthcare space, do you feel like that has an impact on investors' kind of risk tolerance towards the industry?
Yeah. They always say starting a company is about the hardest thing you can do. Starting a healthcare company is that times 10. The challenge with healthcare is it's super behind the times technologically.
Right. Highly
regulated, massive disincentives to change. I mean, you have a very entrenched market, and candidly, I view it not even as a real market. Healthcare, a little bit like education, they're always complaining that education, textbooks, and healthcare, if you look out over the last 20, 25 years, have consistently increased as a cost item. Whereas, generally things go down in cost. Mm-hmm. Those three things they're up, I don't know what the number is, 300% over that time period or something.
Right.
But the exact opposite of what you would think in a modernizing, officially driven economy, a capitalistic economy. And I think it's a product of them not really being true markets. I always tell people is you think about your children and educating your children or providing them healthcare, you will pay whatever you are capable of paying to the point of bankruptcy to make sure that they have the best education and the best healthcare that they can. So if your uncle or your mother is on her deathbed, you'll do whatever is financially in your power to do to make her well, to get her another day. And as a result, people aren't nearly as cost conscious. And payers know that, providers know that, heck, the government knows that. Mm-hmm. And therefore, it's not really a true market, right? In my eyes. And that's always going to be a challenge. In our country, we believe that if we just create or utilize market principles in healthcare, we can bend the cost curve and all this. I think that you have to think a little bit deeper than that. It's not as simple as this. We should think like capitalists and just with transparency comes efficiencies. I think it's more challenging than that. And as investors, you have to understand that. Again, just the disincentives. There's no real healthcare providers don't want to save money. They don't want to make healthcare cheaper, right? They are, and they'll never say that. They don't really probably believe that either. But just innately in their, fundamentally, sure, anybody wants to make money and they want to make more money every year. Mm-hmm. In healthcare, to do that, you have to have more complicated procedures or more procedures. Now, you think about a healthcare, a payer. Health insurance company, they don't want to spend money on you during the year, but at the end of the year, when you have to renew, they want you to look as unhealthy as possible. Sure. Therefore, they can charge premium. Drive the premium higher. Mm-hmm. So there's no incentive for them to save money, really, so long as they can have loose collusion amongst the industry, mm-hmm. Charge everybody more and make more money. I mean, we have the most inefficient payer system in the world by far. It's upwards of 20% of the health spend is just on admin within the payer landscape. Mm-hmm. Whereas in a lot of countries, it's far less than 10%, sometimes less than 5%. So as an investor, you have to understand those disincentives for change and disincentives for efficiencies and cost savings and all that.
Right.
Especially when you're on our end. I mean, if you're investing in pharma device, kind of the clinical stuff, where you're really looking at new procedures, new life-saving technologies, you can play kind of the revenue game. But a lot of investors, especially on the healthcare IT side where we are kind of non-clinical, we're looking at bending the cost curve. We're looking at finding efficiencies, moving from paper pen to software across the healthcare landscape. And in that space, you really have to understand where the incentives are.
Sure. That's interesting, actually. Circling back to something you kind of said earlier in that point was the idea that a mother, father, whoever is going to spend essentially anything they can to take care of that family member, whoever it may be. And interestingly, my take on it is they would go beyond that even, right? Yeah. You said to the point of bankruptcy and whatever. Essentially meaning that they frankly don't care if they never paid either, right?
Yes.
Right? They'll just let bad debt run and it'll be what it is. And so that obviously has a full circle impact on the industry and with a lot of the bad debt that's out there, which to your point about it not really having a market is makes a lot of sense, because at the end of the day, there's not a driver of what that spend looks like. It's just who got sick.
I mean, as long as you can pass the buck.
Yeah.
And that's in a way that it's set up, you can. I mean, effectively, the only true payers we're all paying, but the ones that really, take the nut is the government and occasionally your employer. But the patient provider are very willing to pass the buck on to them.
Sure. Yeah.
Right?
Yeah.
And that's why end of life care is such a concern. Unfortunately, we have this debate about death panels and all this stuff, but we spend an insane amount of money on the last 2 weeks of life in this country because nobody has a death plan, right? Mm-hmm. And if you talk to most people when they're still kind of of mind, they don't want to die in the hospital in surgery, right? When they're 90 dying of natural causes. Mm-hmm. They want to die at home, comfortable around their family and all this. But 9 times out of 10, it's in the hospital where they're trying to get some last life-saving surgery that's costing an insane amount of money and isn't effective.
Right.
That's a huge problem. But how do you fix it? Palliative care is important, death plans are important, but unless you mandate it, it's not going to happen.
Yeah, and then we're opening up a whole other can of worms there when you talk about what are people making life decisions about at the end there. So circling back to kind of earlier question, I wanted to kind of get out of you talking about some of those portfolio companies and just generally in the fund as a whole. Is there a company that you can think of that you look at now and go, wow, I was either way right or way wrong about what direction they were going to go?
All the ones in the portfolio I was way right about.
Sure, of course, right?
Unfortunately, the fund hasn't been around that long. So we started investing about 2 years ago out of the fund. So just the lifespan of the companies are still super early stage. I mean, many of them haven't raised their next round of funding yet. None have died. Those that went out to raise have raised again and raised well. We have a couple additional ones in market currently. So the fund generally is doing very, very well. I think, there's a couple that I love more than the others just because maybe I had more of a voice in the decision, or I had a very clear view on the market and we went after it. Because there's 2 ways to really invest in venture. One is doing a deep market dive, like developing a view on a market. The other is when you run into a good deal, either that was brought to you by another venture capitalist or brought to you by just some other individual in your network and acting on it, that's the other way. So it's I didn't really have conviction on this space, but there's other really smart people around the table. The team's awesome. I'll run after that. Then there's the ones where you really dug in and created a view. And it's the ones you develop a view around that you just have a little bit more of your heart, honestly. I'm certainly not going to name names. There are those in our portfolio a little bit more.
I'm sure they know who they are.
In terms of the ones that we've missed, I wouldn't say that, it's a product, again, of us being early. I can't say there's been one that's just taken off. Because it's not like consumer where, you skip out, you don't take Uber, or you don't take, Bird or something where they go from 0 to a couple billion in 12 months. That doesn't happen in healthcare. Right. This is this business development, company development process in healthcare takes a lot of time.
Right.
It's not a 1 year thing. It's not a 5 year thing. It's generally 10 years. Mm-hmm. So you don't really get sour on stuff or feel guilty for missing out on something or whatever. Yeah. So haven't felt that yet. Yeah. There are some in the market that I wish candidly we would have gotten into. Mm-hmm. A couple that we were close to that we didn't commit to, or just some that we missed. But none that have taken off where I'm oh God, I missed out on a lot of money.
Right.
So
yeah. I don't know if you have a kind of a more specific answer there, but you touched on something that I was going to ask a follow-up question to is what do you think that runway looks like for when you can really kind of maybe define whether this company has quote unquote made it or is going to become successful? You said, certainly more than 2 years, obviously, in healthcare. But do you think that there's a ballpark number or time frame that you feel like, now they really got their hands around it?
Totally depends.
Yeah.
I mean, I think with Safer, they raised a really big round of funding, which obviously we're very helpful. They're doing great. I wouldn't say they've made it, but you start to believe that, okay, there's some market acceptance around this. And certainly, within healthcare, there's a couple issues you run into. One is what kind of like the pilot plateau, where you have 2 or 3 pilots with health systems or payers, whatever else, and then you kind of run with those for a couple of years, and it never develops past that. Then there are those that start with 2 or 3 pilots, and you sell to 10 or you sell to 20 health systems. That's when you start to get comfort around, okay, there's a very clear market here. We have some acceptance. There's product market fit. Now we just need to on the fire. Mm-hmm. So then you raise that big round of funding, and then I feel pretty good. And we're kind of just getting there with a couple.
Good deal. When you look at some of the things that you just talked about and the challenges and uniqueness of healthcare in a lot of ways, are there things that you now miss about Wall Street, or are there things that you would look back and say, gosh, I really had to change my approach because, as you said, a lot of people are very antiquated in healthcare. Plus, let's face it, they're a little bit more sensitive at times too.
Yeah, the problem with healthcare is there's just not a great eagerness to change, especially when you're investing in healthcare IT or the bending the cost curve, because none of the solutions are really that sexy. Mm-hmm. Investing in the consumer side or B2B SaaS outside of healthcare, where people are just more excited about moving the needle, more excited about innovation and these things, is a little bit more interesting. Candidly, it's a lot more fun.
Right.
Healthcare it is a slog, and you just get. It's a really easy industry to get kind of jaded because again, it's we don't have an efficient healthcare system. It's wonderfully screwed up, which means there's a lot of opportunity.
Sure,
but as a result, and just with how entrenched the players are and how many people are involved and how regulated it is and the ever-shifting political landscape, you don't really know. Like you have a view kind of on where the market should go, but you don't really know where it's going. So we invest in where it should go with an understanding of what's possible and probably where it will go, which I think is a decent framework to use. But it's not like consumer technology where you're like, okay, in 20 years, this is what the world's going to look like. I have a very clear view. Let's run after that. In healthcare, you have no idea. I mean, is it going to be universal healthcare? Is it going to be as it is now? Is it, we have no idea. And that's driven by things that aren't related to business fundamentals.
Right.
And we are fundamentally business investors. That's what we understand. So you do have to have kind of a political lens, and you got to understand, again, the power of the entrenched players, and the mechanism, how they're thinking politically. But it's kind of a crapshoot. So there's a whole number of ways to go after it. Again, the device pharma side is a little bit more straightforward. The risk there is just development risk, it's technology risk. But that's kind of understandable. We take startup risk or execution risk. We don't take quite as much financing risk just because there's so much money being plowed into early stage healthcare now, which is great. Mm-hmm. But you certainly take market, political, regulatory risk. That's where it gets a little bit scary.
Sure. So given kind of to your point about you have a limited view about where or what the market or business healthcare will look like 10 years from now, 15 years from now, how do you guys make that investment decision, right? Like,
again, it's a firm belief in the way that it should look like.
Sure, okay.
And then you kind of mitigate that view with your knowledge of what is possible. Mm-hmm. And luckily, we have fairly deep background amongst our advisory team, my partner, and others we surround ourselves with in healthcare IT that understand where it's been and how far it's come in the last 25 years. And then you kind of extrapolate that forward. Now, the political stuff that's something that it's going to be very difficult to gauge, right? Very difficult to predict. In that, you try to avoid as much as possible, so you invest in stuff that's not going to be directly impacted. Mm-hmm. So if you're really focused on bending the cost curve, staying out of the payer landscape, you can do that. Making healthcare systems more efficient, that's not directly going to be impacted so long as you stay out of the reimbursement process or something. Stay neutral there.
Right.
If you're trying to disrupt payers, it becomes more challenging. That said, there's some, this kind of like Medicare for all. A lot of the big names that have started to disrupt kind of the payer landscape, the Oscars and Glovers, Bright Health and whatnot, I think they've built themselves in such a way that if that market were to totally go Medicare for all, which I think there's a chance of happening,
Right.
they would be well suited even in that market. Because all of this, if we go Medicare for all, it's still going to be market based, as kind of Medicare Advantage is today, and they are ideally suited in that world, better than Anthem or anybody else.
Right.
Because you have to leverage technology to do Medicare Advantage.
Right.
And these are the guys and gals that are building those systems and technologies and whatnot to manage populations efficiently. So there's one way to go back. Now, that said, those companies have had to raise hundreds of millions of dollars each to be viable.
Right.
One of our companies, Decent Health, is in that space, but has figured out interesting ways to avoid that financing. So we're very excited about that one, because it does kind of play in that space. They've insulated themselves knowing that Medicare for all is a possibility. So if that were to happen, how do we continue to play and be, uniquely more efficient or more consumer driven or whatever else?
Right. That makes sense. Thinking about a lot of, these companies, obviously, we could say this probably about ones that the fund has actually brought into the portfolio, but generally speaking, has there been a company where you feel like kind of right out of the gate, you heard the pitch, met the team or whatever, and said, you know what, that one hit home either because of maybe the idea, or you're just like, that's such an interesting idea, I think this is going to have a substantial impact?
SafeRide is the one I always use because it was so obvious, knowing how messed up that market is. So they play in the NEMT market tangentially. NEMT is non-emergent medical transportation, non-emergency. That's basically like wheelchair vans, and gurney vans and whatnot. So providing transport services to non-ambulatory patients, and that can be physically non-ambulatory, it could also be mentally non-ambulatory, mental health issues, or just old age. That market has got a very long tail of providers. It's super antiquated. It's driven by a couple of big players, Logisticare and a couple others in the market that are just call centers, paper manifests, very antiquated systems. So the pitch was effectively, let's just provide the intelligence of Uber to that market. And so long as we can kind of create a business that attracts all those AMT providers to our platform, we win. And they went out and did that. And they're doing very, very well today. And that story to me just resonated because it's got, again, these business principles, but playing in healthcare. Because getting individuals to their appointments on time and discharging them effectively from the hospital, opening up those beds, makes your system, your hospital more efficient. And again, so long as you're not impacting revenue to the negative, but cutting costs out, that's beneficial to the provider. They'll invest in that, pay for that all day.
Sure, yeah, it's a new patient, new procedure.
And then you think about like population health and stuff and where that market goes, because in the new kind of Medicare Advantage landscape, Medicare for all, population health, all of a sudden it starts to become beneficial to invest in your patients, getting them to their appointments, right? So if I can pay to get you to your appointment, and that increases the likelihood of you getting there by 90% or whatever, I'll do that. Because you not making that appointment means my provider, I don't have anybody else to fill that appointment. Right. So I lose the revenue.
It's missed revenue.
So I'll pay $20 to get your appointment because I'm going to make $500 on this appointment, right? Yeah. And you think about the population health landscape where you can kind of intelligently predict need and stuff, that starts to get pretty interesting. The transport market just generally, I think mobility broadly is very exciting. But within healthcare, it's very clear.
Sure. Yeah, correct me if I'm wrong, or maybe you know this, I feel like a couple of competitors that began to pop up in that space.
There's a number, and the way that we did that deal was we went out and met with a lot of before we committed to SafeRide, we met with a lot of the competition out there. Got very excited about this team and their kind of how they were thinking about building the network and building the company. Ultimately, that was the decision. It was like, we believe these are the individuals that are going to win. Let's back them, and we did. And we led that deal. We did it with Bonfire Ventures out of LA, then NEA, Press Associates, which is venture funds in the world, came in behind us. So that we're pretty excited about.
But
that's one of many. That's the one that I developed a view on very early and got excited about. And to me, the investment story was very straightforward. Whereas healthcare, they're typically not straightforward.
Right. Yeah. Do you feel like that antiquated approach, that slow to move culture in healthcare, is it culture driven, or do you feel like it's more driven by
there's no incentive to change? They're making so much money. Why would you?
Yeah. I guess in some ways.
Like you think about payers, they're doing better today than they've ever done.
Right.
And everybody's complaining it's getting more expensive. We're going to move out of the markets because it's just we're paying too much. Anthem's never been more profitable. United Health's never been more profitable. So providers are doing generally very, very well. Mm-hmm. Massive consolidation. There's a lot of areas to improve, but generally everybody's pretty happy and content. So why change?
Sure.
If you get down to the provider level and you actually spend the time to have a beer and talk to a physician, they'll tell you, yes, this is not the way that it should work. Mm-hmm. I don't have the power to change it. So, I'm not going to spend my time and energy too when I can just see my patients, take care of them, and make money. Yeah. Right? They know that it's there's a better way to have positive outcomes, save people money, get more care to people. But the system's not really designed to do that.
Right. Yeah.
Unfortunately.
No, you're right. And the time and energy put there, they could just be putting it to another patient.
That said, one thing that is very interesting to us is kind of it's a long-term play. But it's this issue, and a lot of people saw it on the nursing side pretty early, where it's just the shortage of nurses, very clear, right? But the turnover on the physician side, physician burnout, as a result of revenue pressures from hospitals, just the cumbersome nature of our healthcare system, documentation overhead,
learning EHRs every day.
You're starting to see pretty significant turnover where guys are like, and gals are like, I made enough money, I'm just going to get out of the business, or I'm going to get out and become a consultant, or I'm going to go and do something completely different because this isn't worth it. Mm-hmm. Regardless of how deeply they cared about, taking care of their fellow man and their patients and all this, they come to the conclusion it's not worth it. Just the headache and me beating my head against the wall for the last 10 years, I just want to get out of something else. So this notion of physician turnover, making their life more efficient, enjoyable, taking out the documentation burden on them. So we invested in a company called Robin Health. Very exciting company out of Berkeley. And there's a couple other guys going after this. Augmetics is one of them. They did it with Google Glasses. But basically it's developing an AI to automate the physician documentation process. Robin's doing it in a very intelligent way, and that they're doing it kind of over time. Understanding that building that AI, just from a dead stop,
right,
and then selling that is going to be immensely challenging, probably impossible. Mm-hmm. But let's leverage remote scribes to do a lot of this, because scribes is a big business now, right?
Yeah,
that's just people doing medical documentation for physicians. Let's leverage the power of a remote scribe, and over time make them more and more efficient. So you go from one scribe for every couple doctors, 50 doctors. We can do that. Also, we can make kind of supercharge the providers, cut out that 20 hours a week they have to spend documenting. And then you can also do some really interesting things about how you document, how you record within clinical setting, both a primary care, but also in a specialist, but also in hospitalist setting. Start to get a better health record.
Right. No, that's interesting. I immediately, given Hydra in my business, I think about burnout for physicians is heavily driven by EHR documentation nightmare, and it seems like every EHR and or practice management system is doing something to try to make their user interface more friendly or more simple or whatever it may be, right? But this group here takes a very interesting approach to ultimately solving the same problem, but in a very different way, because let's face it, either one, the doctors are so checked out anyway, it doesn't matter what you did to the EHR, they're not really going to feel better about it. Or two, nobody's just done it well enough that it really feels good to be able to sit down and document in front of an EHR. So that's a really interesting concept. I'll have to check them out a little closer.
Yeah, so this question is how much can you do without them having to enter anything?
Right.
Just from voice, from, it could be video of them, a recording of them touching a patient, elbow, whatever, manipulating their arm, and you as a scribe or you as an AI understand, okay, so the problem's in the arm, doctor walked me through what the issue was, and document that. And then automated ordering and all that also can be tied into that.
Right.
So you start to pull the doctor out of that documentation process and make them, again, kind of super.
Yeah, and for years, I mean, there's been various ways that the industry's done that, as long as that person is not diagnosing, right? Legally, regulatory speaking, you're good as long as they're not diagnosing. So that certainly opens up that gateway. That's interesting. I like that. Well, will be interesting to see where they go. You just
again, these are all that investment was 9 months ago, if that. So still, and that was it was almost de novo. So still very early stage, but excited about that.
Well, we got
an incredible team.
Yeah,
and that, as you know, I don't want to harp on a cliche, but the team's everything. One thing I would say about a portfolio is all the teams. Great.
Yeah, what I think, I'm sure push comes to shove, a good idea with a great team probably gets a little extra interest, versus maybe unless it's a really great idea, right?
Yeah. Well, no, I mean, that's like the team, especially in healthcare, where whenever you're investing early stage period, you're investing in the team.
Yeah.
A team in a market, but it's the team, because your solution is going to change. What you're doing, your market could totally change. But you have to have a team that is robust enough, durable enough that when they hit a road bump, they're able to kind of pivot or reposition and then move into to merge.
Yeah.
That is the most important.
Sure. Yeah, it's probably the one thing you can count on, right? It's the one predictable.
The only thing.
Yeah.
Your team is basically the only thing. I mean, team, and then I would say if you can mitigate team risk, execution risk, and financing risk, then what's left is kind of like market, which you can generally get your head around. And
yeah, that makes sense. Just a couple of minutes left here. One last question that I have, moving away from healthcare specifically a little bit, but is there something that you feel like when you meet entrepreneurs, a team, are there things that you see that are consistently kind of left out where you feel like, why are they not learning this, or did they not go into their research, or maybe in a business plan, or are they preparing and planning?
The question is like consistent. There's not one thing that I can pin that is this is always missing. Do this better. More about the team, I guess. A lot of most of the pitches you see are driven heavily by product, which is funny because anything you read from a VC, they're going to say market, team, because those are the two most important things, right? So people really typically dig into the product pretty hard and leave out the team. Product you kind of have to understand because it gives you this is where we're starting, and then also the pathway. I would say I want to understand from you the steps you're going to take to go where you want. Ultimately, your big idea is 1,000 steps from where you are today. So what are those 1,000 steps?
Right.
Walk me through strategically, HR-wise, who you're going to hire, when you need to hire them, all this, financing, when you're going to need to raise additional capital, and how the product's going to develop. The best entrepreneurs have that. It's not going to be super clear, but at least they'll have some understanding of, I know this will be required to get.
Right. Yeah, you got to know that they've thought past tomorrow.
Exactly.
Right. Yeah. And I think that's still just in a different way. It goes back to the team, right? That's a way for you to do due diligence on that team and see if they've done their work too. Yeah. With our last question here, all the things kind of pulling full circle. Where do you kind of see VC/healthcare going over the next 5 years? Maybe in terms of either focus and/or challenges that possibly are presented.
Healthcare, who knows? I mean, I think Medicare for all. This 50 days from now or whatever, when we have, that's going to be very, very interesting. That's starting to get some traction. And ultimately, I have my views, and they're going to be pretty controversial, especially in the circles I run in. Yeah. But Medicare for all seems like a very. I always use the statistic that we spend 18% of GDP on healthcare in this country. This is we're so we spend $1.5 trillion too much in healthcare. A really good way to mitigate that. That's actually the way to do it. Again, I don't believe fundamentally that healthcare is so taking a marketplace approach to everything and harp on the Reaganite leverage the power of the market doesn't exist in healthcare. Even though I believe that fundamentally in most things, in healthcare it doesn't work. So you have to have a little bit of a heavier hand if you're going to run an efficient system. So where it goes, I think that there's high likelihood. I think people have started to enjoy their kind of universal health care, although it's not totally universal today.
Right.
The heavier hand the government's playing system, I think that people like, I can't be rejected, my kids are on until 6 or whatever, like all those things. And so how do you create a health system, a functioning, successful health system with those things? On the VC side, I heard a really interesting talk with some of the team from Benchmark, Leaf, about kind of the weaponization of had more $100 million rounds this year, where Capital One, there's just so much of it out there, and there's so much being held for growth investors. And those generally looking for yield, which is like the narrative. Right. Since I started on Wall Street in 2006, 2007, whatever it was, yield has, the treasury rates have been like zero. So everybody's been in this deep search for yield since I started my career. So that's like all I understand.
Right.
But just an abundance of capital looking for somewhere good and interesting. So people have realized we can just plow into technology because that's where all the returns are. If you look at the stock market's done nothing for like 5 years outside of 6 tech stocks.
Right.
And as a result of their success, the market's done very, very well broadly. All you have to do is invest in Amazon. Done better than any fund manager in the world.
Right.
But people are starting to pour money into venture in technology, and there's not a lot of places for it to go. So you start to see Bird and Lime raising $500 million in 6 months, right? Where then it just turns into a weapon, right? Like there is literally nothing different from Bird and Lime between the two of them. Neither is better, neither is worse.
Right.
They are functionally identical.
And they're scooters at the end of the day.
Scooters, right? Anybody could enter that market.
Yeah.
There is, but you will win if you raise more money.
Right.
Ultimately. So it's the weaponization of venture capital where you can now have a solution that is worse than what's currently in market. Like there could be somebody that's been in market for 30 years, a nice incumbent solution that's always been there. But if you're an upstart company, maybe a little bit sexier, but not functionally different, with a hell of a lot of capital behind it, you can win. You can take it in time. You can steal a market from somebody just by leveraging the power of venture capital.
Yeah.
Because there's so much out there, and people are using it in that way. They're just overcapitalizing companies to literally steal markets. And once you stole the market, you got everybody on your platform, you win. And then you start like kind of with Uber. Like they've been paying people to be on their platform for how long now? Never making money. Knowing that if we get to the point where we take the market, we win, and then we'll return. Yeah. But with the nature of venture capital, so long as if you could stay private forever, and in today's world you can, basically just passing the buck on to the next guy. Yeah. You never have to return anything.
Yeah. Right. Technically, everybody kind of gets their money along the way.
Until every competitor, until you own the world, you never have to. You never have to be profitable. So long as you can just convince the next guy to invest at a not even a higher valuation, because nobody seems to care anymore.
Right.
Just as long as you can bring more money in, you can take the market, even if it takes 20 years. I would that's a big theme. Yeah. I don't know what's going to happen there because it's definitely relevant. Like we're in 20 years, what does the world look like when you're leveraging the power of capital to take markets? Totally.
Yeah, like you said, you already touched on as Amazon for the longest time. Yeah. Nobody realized that they weren't making any money until they started doing AWS and some cloud computing services. They were losing money year over year, hand over fist. But yeah, it's interesting.
But I mean, that's kind of what they did. Is they had the power to lose a lot of money, take a market, and then flip that switch to immediate profitability once they own the market, and then plow all that money into a new market. Yeah. Go into that market, lose all the money in the world, but take the market, flip the switch, be profitable in that market, take all the money and dump it in a new market to win. The guy's a genius, there's no question. Yeah. But
it's not the traditional business model.
It's starting to look like 2000 or 1910 again. Yeah. We're going to have to start, truly, probably have to start busting up companies. And I love Amazon, don't get me wrong. And he's a brilliant investor, brilliant businessman, brilliant operator. But that starts to get existential risk of capitalism and democracy and society more generally, which is that's a longer podcast.
Right.
But just back to the original question, kind of this notion of weaponization of venture capital. I think the thing you can't forget is just like there is so much money out there looking for a place to go. And one easy solution is let's just kind of collude. Let's all get together, overcapitalize a company, and take the market. And so long as our time span is long enough, we'll win.
Right. Well, there are two things I can say from that. One, certainly being an entrepreneur and having started my own company right now too, I can agree that there's plenty of times along the way where if I just knew I had enough capital, it would completely change my strategy, frankly, in a lot of ways, what I'd be doing today versus tomorrow and the next day, right? But, the reality is the situation, you got to account for that. And so, point being is I can easily see where overcapitalizing, weaponization is a very real thing and how it certainly can be beneficial.
I will say it works a lot better on the consumer side.
Sure, yeah.
Like in healthcare.
Well, true. No, absolutely, right? Because you just put it all out there, spend more money marketing, put it everywhere. Your name shows up enough places. On the consumer side,
well, no, it's like like with Uber. You think about mobility, the future of mobility. I'm not going to have 5 apps on my phone for my mobility solution.
Sure.
So Uber can just, so long as they give me enough free rides,
right,
they'll end up being the only app on my phone that does transport, mobility in general.
Right.
So now Uber cars, Uber scooters, Uber bikes, Uber planes, Uber whatever. They own me. Mm-hmm. My transportation is through Uber now.
Right.
And that is ultimately, like from a consumer's perspective, that's a really easy solution. That's ideal for me. It's elegant, it's all unified, it's very straightforward, very clean, cheaper than what I'm spending now on a car and anything else.
Mm-hmm.
But again, it starts to have one mobility company.
Yeah. Uber, public bus transportation, things like that, right? My final thought is I don't know if you've ever watched Silicon Valley or if real VCs watch that show that's all Hollywooded up. I guess.
Hilarious. I mean,
it's funny, right?
It's a ride.
Yeah, but the overcapitalization thing. He makes that decision where Megan explains to Richard to say, don't take this. You're worth nowhere near that. Yeah. And then what are you going to do next round when you don't meet that benchmark? And then you have a down round and you're screwed.
Yeah.
And then he obviously goes back to their CEO who had just bought the house from Google or from his acquisition from Google, and he basically bit him in the ass because he took too much money and never could hit that benchmark again. And then it's kind of the back end downfall, right, in a different way, but the idea of like being conscious of how much money's there, that's obviously very different than what you're saying is starting to change in the industry. It feels like where you get enough eggs in the house and then you're good.
Yeah, again, but the weaponization, that's more of like it's not so much as like a venture capital operating thing, it's more of just a finance trend generally, and that you can be private forever. Hedge fund private equity guys are now starting to get into venture. Mm-hmm. Like the public markets aren't a solution for a lot of people. Like it's more of like a macro finance. Because operationally, to get to the point where you can actually push yourself, you have to have a really good idea.
Yeah, I follow you. That makes sense. A little bit of just
and not nearly as relevant healthcare. It's That said, I mean, Epic kind of did it.
Yeah.
So it took a lot of the market by having the government pay people to work.
That's true. Well, Alex, appreciate your time today. Look forward to getting this out on the episode or getting this out on the air. And thanks again for joining us.
Absolutely. Thank you for having me.
Thanks for joining us today. A reminder, the secret word is capital. And in the upcoming weeks, we will feature episodes with an executive director in the therapy space, as well as an executive in the ABA area. A very interesting and, quite frankly, a kind of up and coming still, it seems like at times, accepted part of treatment among those who need it. And so it'll be really exciting to talk with her and get some more insight as to where she believes the direction of that particular type of service goes in the future. Thanks again for joining us on Get Hydrated, the podcast about the people of healthcare.